Hi, this is Charles, also as Dr. Ghetto here. Obviously, by today, you guys are aware that Senate is proposing that healthcare bill. Obviously, already passed the House sometime early last month, if not late October 2009. And it seems that I actually looked at their Congressional Budget Office letter that was sent towards Harry Reid and Mitch McConnell, one of the mainline senators, among this proposing this type of health care for the Americans. And I started to not like it one bit even before I read the excerpts, because the government, they're not supposed to mandate us health care, because based upon what I saw through their PDF file of the letter on their analysis of Patient Protection and Affordable Care Act from the Congressional Budget Office, it's more of control than it is of better quality service. They provide more. They say they want to provide more subsidiaries. They also want to try to do their best to bracket out the amount of income tax will be placed upon your income, of course. And it seems that also Harry wants to replace the HR 3590, which is the bill that's supposed to be for first-time home buyers to receive tax credit. Basically, like about if you want to get a new home for the first time ever in your life, they'll give you $8,000 if you sign with the government. And obviously, that's still a bad idea, because you're basically just distributing money from one taxpayer or a group of taxpayers to another taxpayers that can't afford it. And that's not a good sign right there as far as it comes to socialism. Yes, indeed. Now, in my notes that I took regarding about this is that individuals and families experience changes of being larger or smaller or opposite direction of the estimated changes, i.e. if you're healthy or younger, you may see increase on premiums. So if you're a very healthy young lad or something, like you're as athletic as a Michael Jordan and you're not as crazy and such and so on, you'll be taxed more. You'll get more. Be taken out more of what you have for your money, just based on your stats, if you submit that in. Now, in the average premiums, it will be 27 to 30% higher, because a greater amount of coverage will be obtained. And as my other note, the average premiums per policy in the non-group market will be $5,800 for single and $15,200 for family. I hope that's not yearly, because after a while, if you get taxed that much, which that's the average, keep that in mind, that's not a good sign right there. That's more money towards the government instead of for the service. Page 9 of 23, that's based on a PDF file format, not of the actual Congressional Budget Office page. That at the beginning in 2013, insurance policies with relatively high premiums will be subject to 40% excise tax, the amount by which the premiums exceed a specified threshold. So basically, we're going to see higher premiums, higher prices, so on and so forth. The subnote on page 15, small employers' administrative costs decline as a share of premiums as the size of the firm increases. So basically, if you're a very small, like let's say a telemarketer of only like 50 people, you'll be having this type of increase in payments or something regarding about that. And if your firm gets larger, so instead of have 50 employees for the firm, you'll have like 200, it will be lower. Kind of a weird correlation right there, a weird reciprocal of things to add it like that. Another note I have, in black bolded on page 16, new fees would increase premiums slightly, imposing many new fees on firms in the health sector, and manufacturers and importers both will be passed to consumers on a higher premium for private coverage. So consumers, think about this, guys. This will be imposed to some sort of like another tax or another fee just for buying apples and oranges or a computer. I can't imagine that. Even though it's broad as what this document is saying here on the computer here, it's still not making any sense at all. Why would you want to pass it on to the consumer? Because consumer is basically covers set on about approximately 70% of the United States economy. Stupid right there, I would say, in my perspective. Now, page 17, on the other hand, the fees will be decreased in the long run. Well, that don't make any sense either. Again, in the long run, they probably think like 10 to 15 years from now, oh sure, everything will look fine, everything will look all crazy like and increase in prices, and in the end, it's still going to be it's going to be great. It's going to be better than the coverage that you had with HIP or with Starbridge or Cigna, those type of companies. And another note, by 2016, 162 million people expected to be covered by employment-based insurance. In that year, in the current law, 14 million by non-group policies. So basically, with 162 million, that's half the population is right now, which is right now we're up to about 310 million people in the United States. Now, page 20 of the footnote, CBO estimates that uninsured and insured people will take account differences between groups. So in a sense, we're basically distributing wealth again. Page 21. Refusing mandate insurance is $750 per adult, $375 per child in 2016. Now, if I remember correctly, based upon that JCT letter, of course, with the clarification of healthcare bill, I'll post in the video of what I'm referring to. And my last video, and that last video about healthcare again with, with the House of Representatives, as they already passed the bill on their end. That there's supposed to be some time